Please welcome Ross and Dan.
Thanks, Steve. So I wasn't planning to start with this. How does it feel to work for a company that sounds really boring?
Yeah, I was going to say, I was going to say a bunch of nice things about Steven because he's so important in Chicago and so important in healthcare. And the fact that it's gone 5 years down the road really is to relevance, as we talked about before. So huge what Steve means to this community in terms of healthcare. With that said, that was a pretty crappy introduction. But it sets the bar low, so like, I guess I have to prove I'm, doing something that's a little bit more exciting than boring.
Let's well, let's do this. I think over the last week or so, you and I have talked a few times, and I found it really interesting, and I said this to you actually the other day when we were talking, that most people who've been in healthcare for a long time are really deep in a vertical, whether it's biotech or services or whatever it is. You've actually been in all of them, and you're actually one of the first people that I've frankly met in my career who's been in all of them. So, it's always helpful, I feel like, to start just these conversations talking about how did you choose healthcare? Everybody has a reason. And then your journey clearly took you kind of through that pinball machine that's a little bit differently than most people have.
Yeah.
And so I think just getting a feel for that for the group, I think would be really helpful and interesting.
Yeah, I mean, when I graduated from school, like a lot of people, I took a job and, not knowing necessarily where it would go. But after a year, I didn't like where it was heading. So I was pretty bored and not really challenged and not feeling too good about my future. So instead of looking for another job, really what I did was I went shopping for a place where I would spend my time and a place where I could make an impact. So I looked at a bunch of different things, and I really went interviewing industries, for lack of a better term. And when I thought through healthcare, biggest industry in our economy, so there's always going to be jobs, maybe the most messed up industry in our economy.
Sure.
So there's always going to be problems to solve, which is where I want to be. And then obviously there's a human factor, associated with it, which my mom was a teacher in the inner city in Chicago for 33 years, taught in a trailer on the south side of the city for 2 years. So I think the kind of embedded experience of wanting to do work that matters and touch people always really resonated with me. And so we have a saying we use that what flows through our software is not bits and bytes, but human lives. And I truly believe that. So I went interviewing for healthcare companies. I just kind of went cold calling on a bunch of them. Got rejected by 9, so I interviewed with the 10th and got a job with a little pharmaceutical company, probably the 19th largest in the world, which maybe doesn't exist. Pharma companies, there's 5 of them, and then everybody else is an afterthought. But it was called ICI Pharmaceuticals. It had a me-too drug that Merck also had, but by focusing on a niche, they ended up outselling the #1 company in the world.
Wow.
And it was a really good lesson. And after a year, I got moved into the hospital setting. And I had this drug that was used in the OR for induction of anesthesia, many people know, called Diprivan and Propofol. And I got to, weird thing, I just didn't know what I was doing in surgery, but here I am watching open heart surgeries and, and everything else. And I found it fascinating and also puzzling because it was incredibly dysfunctional, what I was observing. And I'm like, how could I see this and not other people? So when I got done with my MBA, I went shopping to try to get a consulting gig. And I did operations redesign and strategy consulting for hospitals, what used to be called re-engineering and patient-centered care, some people might remember, back in the 90s. And within a couple years, I was running half the country for this consulting group. At the time, I was getting married to my bride, Kim, who's in the back. And I made a decision, like, now would be the time to take a pay cut. And so I did. And I just thought consulting would take me down one track. I wanted to go down another. And I ended up working for Baxter in the renal therapy group, which really, if anybody knows this business, there's peritoneal dialysis, there's hemodialysis when you go into a dialysis center. Baxter was really trying to grow the peritoneal or home dialysis business, and that was my job, is to help build out, along with other people, that market. So instead of marketing a product, you're really marketing, you're trying to build out a market. And so that experience was pretty unique at the time. But at the time, technology was evolving. I was relatively young, and I'm like, healthcare, lots of problems, tech, I want to be there. And I read about some sleepy little company in Libertyville that had a warehouse full of medications, but they were trying to put an electronic prescribing front end to it called Allscripts. I cold called them. They were only 5 minutes away from where I was at, so I figured I can go talk to them during lunch. That ended up turning into a job and a career of helping to build up that company. At the time, Allscripts was 50 people. We had a warehouse of medications. We were trying to put an e-prescribing front end on it. E-prescribing didn't exist at the time. And really to sell these medications on the back end. So what that business became, as many people know, was a big electronic health record clinical play. Made a lot of acquisitions over the time I was there, and along with many other people on the team. Grew the company from 50 people to about 6,000, from about 20 or 50 million, somewhere in that range, to over $1 billion. So that was quite a ride. But having spent my entire career on the clinical side, when Strata came along, which we'll talk more about, it was on the financial side of the house. I knew not a lot about it, and that's what intrigued me. And we'll get more into that story as we go.
Yeah, that's great. And so the Allscripts, again, for a lot of people in this room, Chicago company, people are familiar, and again, huge rise, $1 billion+ market cap company.
$1 billion+ revenue, just to be clear.
Fair point. Yeah. So I guess just as you think about a company like Allscripts, you think we're starting with a company that grew as much basically as it has. What was that experience like for you? Kind of what was it like when you started? What were the challenges basically in taking it to that next level and then eventually going public, et cetera? Kind of what were your learnings you've taken with you over the course of your career?
Yeah, well, there's an hour right there.
Right, sure.
So it was an incredible ride. I mean, I was there for 12 years, and the company morphed into many different things over time. We did 3 mergers in the course of 6 years, so the business changed dramatically. Where it started was a PBM, then it became a medication distribution company. Both those businesses went away. It morphed into an e-prescribing company. That went away. It morphed into electronic health record company. That went away by itself and became a much broader set of solutions over time. But it was a 24-hour day, 7-day week kind of deal. I mean, it was definitely a bunch of folks in the trenches, as this has been described. Really trying to build a market for e-prescribing and a market for electronic health records. So we were involved working in Washington with the Bush administration, just trying to get the term electronic health record in the State of the Union. We were involved with the Obama administration, helping to create the standards around electronic health records, because you couldn't provide funding for something that wasn't defined. So I was part of what was called the Certification Commission for Healthcare IT. And then we were instrumental in kind of working with the Obama administration to get $33 billion in funding for electronic health records. So, what I was trying to describe, I guess, in saying that is, I always had 2 jobs, sometimes I had 3.
Yeah.
And that was just par for the course in terms of how we all operated. So I haven't been with the company for 8 years, so I can't comment on the current structure or status of, kind of the work that they do. But at the time it was, I think the mistakes that we made along the way, now that I look back at it, were more around trying to do financial engineering to some extent around the company by bringing all these transactions together and trying to make that technology work and integrate proved to be extraordinarily hard, much less trying to merge the cultures and the companies and everything else. So while the top line looks really good, some of the stuff that was kind of underneath that type of approach, other companies had the same experience as Allscripts. So whether it was Michelson, whether it was GE, whether it was Siemens, the list goes on. It's just a very difficult way to sustain a customer and employee experience, and that's kind of part of the struggle that we had, and that certainly informed my transition when I made it to Strata.
Yeah, and so let's go to that, because I think one of the other things that really resonated with me, it feels like you've been very deliberate as far as the culture at Strata, the business, the way you guys manage relationships with your customers, and the way you've developed your product and even talk about your product. Everything feels very, very deliberate. And so I think it'd be helpful for the group just to hear a little bit more, what is Strata, what does the company do, what's changed basically during the course of your time, and then we can kind of go from there.
Yeah, and just to give everyone the right lens on this, so Strata was started in 1996 by a husband and wife team, Don and Catherine Klimans, at University of Illinois. He was a professor in finance, and Catherine was really the lifeblood behind the company. They sold it to a private equity firm in 2011. I came in 2012. At the time, it was about a 50-person company, exactly the same as Allscripts when I initially came there. And that was part of kind of what informed the decision was like, I think I know where to go from here, potentially. When I looked at the business, I didn't really understand it, and I'll explain it in just a second. So I went around talking to a bunch of people who I knew in the industry, asking them questions about it. And really, my core question was, do you understand what things cost? And when I asked people that question, the answer that came back was, some were talking actually about price, some were talking about charges, some were talking about reimbursement, some were talking about the actual cost, and then there was the provider perspective, the payer perspective, and the patient perspective. And I think any market opportunity is defined by the market problem. And so to me, boy, wait a minute, this is a $4 trillion industry and maybe the biggest socioeconomic issue of our time, and yet the people who are closest to it have no clue what things actually cost. That's what actually got me into the door. At the time, the company really had built out its business around financial planning. So it's a cloud-based solution. It has been for over a decade for long-range financial planning, capital planning, operating budgeting, things that some people, their eyes may be glazing over when they hear that. But really, that is what sets the tone of what gets invested in and then managed within our healthcare domain. So if you're building a company and it's not in the budget, well, guess what? So to me, that part was intriguing in that it wasn't intriguing to others. So I am a contrarian. I'm a White Sox fan. So I like to look the other way at things and look at them backwards. I grew up, I was actually dyslexic when I was growing up, so I think I've kind of battled through that. But looking at things backwards, you can see, well, someone's going to have to know the cost of care.
Sure.
And, or someone's going to build that market. And I actually think, I think we would all acknowledge that Epic has won the clinical market. But if you say who's going to win the cost market, I think you would hear crickets on that. I don't think people would say, this is that company. I think there's lots of different companies who are taking a little different shots at it. But the opportunity to be the platform in that space, that was really intriguing. So Strata, like you said, or Steve said, serves 25% of US healthcare. Locally, Advocate, Northwestern, North Shore, Edwards Elmhurst, OSF, nationally, organizations like Kaiser, Cleveland Clinic, Intermountain. So roughly 220 health systems run and operate on Strata. And the way that they use the system is everything from, if you're the CFO of a health system, think about it this way, everything from how you set your long-range plan to how you translate that to an operating and capital budget to then how you hold people accountable to that. That was the core business. When I came, we were launching into decision support within the financial space. What that means is cost accounting plus payer contract modeling so that you can understand not only the cost of something, but the margin. And that business was really sleepy. There's a bunch of companies in it who've been doing it for a long time, and largely that market wasn't served in a way that anybody ever used the data. So that seemed to be an obvious opportunity. And what we've done over time is we've built applications resting off that cost structure to help activate that data within the organization. So for example, if you understand the cost of care and you can understand the variation of care, well, maybe you can point out where the opportunities are to drive efficiency or eliminate waste. So we've automated all that. If you're trying to price within your market to understand what a rational price would be. I know we all talk about price transparency and see this issue out there, but the reality is, if you don't know your cost, you really can't price. So we have an algorithm that allows us to understand that data and use that data to inform pricing, taking on risk-based contracts, which we talked about before. So Strata really is planning, analytics, and performance, and it's a flywheel for the finance side of the house.
So a couple things. One, for the entrepreneurs in the crowd, the lesson learned from that is if it's not in the budget, it's not getting paid for. Two, so let's talk about that a little bit more. So effectively, you're shining a light on what previously has been incredibly opaque, and very smart people have been making decisions with very limited information historically. Yep. So how does that look different? If you take basically a large, sophisticated hospital system doing a couple billion in net patient revenue, what does their world look like, not year one, because I imagine this is a bit of a journey, getting used to even understand what they're supposed to be doing with a tool like this, but you've now kind of gotten all the financial planning and other kind of more straightforward aspects of it. What are the different types of strategic decisions and clinical decisions that are being made by hospital systems today that they weren't making previously prior to the tool?
Yeah, it's a great question. So one example I'll give is Northwestern. So Northwestern launched an initiative a few years back to take out $220 million of cost, which was roughly 25% of their operating expense. They had a huge team that went after that. The person who actually led that effort ended up coming to Strata to help build the algorithms on top of the cost data to do everything that they did in Northwestern automatically every day for every patient across the entire system.
Yeah.
So what that looks like is, for an organization, an example would be like Yale. Yale was able to save $150 million really bringing clinical and financial data together, because if you don't bring those two together, you can't really look at value, and then creating a conversation with their physicians around the alternatives of what they could or should do. So if you're going to drive major savings within a healthcare delivery system, the default option has been calling the consultants. Pay them X, have them here for X time, they leave their recommendations behind, and then you go at it. But what's happening in reality is everybody now needs to reduce cost, right? So the walk that I would give people is, this is a $4 trillion industry with $2.5 trillion going through hospitals and health systems. When you survey them and you ask them, do you know the cost of fill in the blank? 99% of the time they say no. They just don't have any of that data available. So making that data liquid is the only way to really bend the cost curve if they're the ones who control the cost. So physicians and their decisions, providers, I'll go a little bit broader, 80% of the spend that happens in the healthcare delivery system, so you said a couple $1 billion, let's call it $4 billion, well, 75% of that is coming through their decisions, right? So if they don't know what A versus B is, then they don't know if the flight that they're taking from Chicago to New York is $100 or $10,000. That kind of variation is happening everywhere on everything every day. And I'll say this, just to be clear, because we spend a tremendous amount of time with CFOs. I tell them all the same thing. Don't ever make a decision based on cost. Like, it could be my wife, my daughter, my mom. Don't ever make a decision on cost. But you should never fly to New York without checking, right? And that is what's happening today. There are gatekeepers and information behind that gate that people don't trust, so it's never used. So this is the biggest black hole in our biggest industry, is this problem. That's why it's so interesting. Stephen.
So this is beginning to sound a little less boring. Okay, so when we were talking earlier today, I appreciate about this, some of the conversation we've been having. I think that you, in content that can be kind of boring, for lack of a better term, I think you try to make it more interesting, and I think you've tried to use kind of some colorful examples and basically some visual, et cetera. So you had basically earlier when we were talking
Props.
A way to think about driving change in healthcare.
All right,
so would love to give you a chance to kind of fill folks in on what I learned.
So some people may have seen this before, but I'm a healthcare geek. I've been doing this for 30 years, and I think people, I can't quite stand when they oversimplify healthcare with a punchline, politically or otherwise. This is a very complex and really important industry. So the need to really dig deep, right, and get into the trenches, that's where the problems get solved, right? So what I try to explain to people is, like, running a business is like a Rubik's Cube. You turn one side, you screw up the other, right? But healthcare kind of looks like this, right? This is a 17 by 17 by 17 Rubik's Cube, one of the largest in the world. We actually ordered it from a guy in Norway, and then we actually hired somebody, a cubist, to come in and try to break the world's record for solving this. The world's record was 7.5 hours. He did it in 3 hours and 12 minutes, 312 Chicago people. Wow. And you can go to YouTube, you can go to Strata, Rubik's Cube, 17 by 17. You will find the time-lapse video of him solving this. But the point of it is that this is just a bunch of little Rubik's Cubes. That's all this is. So if you know how to solve a small one, then you can work your way out and solve the bigger one. And so that's the point, is that if you're really going to make a difference in healthcare, you have to geek out about getting after one of those problems, but not be so blind to think that you're going to solve everything with a silver bullet. It's an incredibly complex set of problems, but they are solvable problems. So you have to geek out and you got to get into the mix. Our mission as a company is to help heal healthcare. It's not to heal healthcare, we can't do that, but we work with a lot of people who can. So we're here to help them, and that's how we view problem solving. Is we don't really build a product per se. I think a lot of people look at tech companies and they're completely misunderstood. I view Airbnb as a hospitality company. I view Uber as a transportation and logistics company. Strata's a healthcare company, and we're trying to work, these little problems out to help solve the big problem.
So, in that big Rubik's Cube, effectively, I think the term that everybody uses today is value-based care, right? This is the broad-based approach that the country is taking today in all different shapes and forms and sort of sides of that cube that people are going after. And so how's Strata and your team going about sort of the value-based care problem, and what are you seeing today? I mean, you're working with some of the top hospital CEOs and CFOs of the nation. What are you seeing them wrestling with? What are you seeing them gravitate toward to try to adopt value-based care and create value basically for their communities?
Well, they're all interested, they're all pursuing it, but they're all realistic, knowing that their world is in two places at the same time. In either scenario, they have to understand the cost of care. So if you're going to take on a value-based contract, let's just call it a capped contract or a bundled contract, how would you go negotiate that? Well, the first thing you would need to know is, what would it actually cost me to deliver the service for which I'm going to be receiving something for? Once again, these guys are flying blind. They don't know that to begin with. So what Strata does is provides that data set to allow them to not only understand what their cost baseline is, but once they take on a risk, they can understand the variation across their providers and then take action on the detail underneath it. So I'd say that's probably first and foremost is where people are focused.
Okay. It's great. And then beyond the product, I think one of the interesting things, I think honestly for the folks in this room who are looking at, one of the benefits, and it's really a benefit and a curse of starting from scratch and building a company, is you get to decide the culture and you get to decide the team. The challenge of that is, okay, take a deep breath, you get to decide the culture and you get to decide the team. So it seems like you and your team have been incredibly thoughtful about who you hire, how you hire them, what are the values of the company that may frankly not really have anything to do with building a piece of technology that helps solve that problem. So let's talk a little bit about that and kind of how you've gone about that so far with the team at Strata.
Yeah, I mean, it's like, culture really comes down to the people you hire and how you treat them. Sure. It's not really that much more complicated. So I personally interview everybody who comes into the company, and I never give a thumbs up or thumbs down to anybody. All I'll do is give an impression and share that impression. But if that person who's making the decision on who they're going to hire doesn't own that decision, now I've disabled them, right? So we're very thoughtful in terms of how we do that. Also, I do every exit interview in the company. And the best gauge I can give you on the company, or on any company, is how that exit interview goes. So when someone leaves, how emotional are they about leaving?
Yeah, sure.
So there's metrics you can look at, like turnover, and you can look at employee engagement, and you can look at all net, promoter score. You can look at all these things. But what it looks like in someone's eye when they're leaving, and it might be because of a family situation or because they're going to go to grad school or because they're pursuing something else. But that vibe, is really how I gauge how we're doing as a management team, for sure. So the question I get, from people is like, because I do interview everybody, of course they're going to ask that standard question: what does it take to be successful at the company? Right? It's kind of predictable. I actually think our HR team may share that question, potentially, to tee it up. I don't know. So I basically said, hey, whether it's Strata or any other company, I think it's particularly true of Strata, may be different in our companies. There's four things I think that matter the most. One is, does that person have a service mindset, right? So as a leader, are they there to serve their team? And for everybody else, are they really there to serve customers and each other? So do they have that mindset, or is it really self-centric? They're just a brilliant person who can work in isolation. That wouldn't really work at our type of company. Second thing is professional, right? Like, understanding on how to treat people with true respect, right, is something that needs to be taught to an extent, right? But the world has changed, and I think people have to be hyper conscious of. I tell people, like, you should come to work and you should totally be yourself. There's not a home self and a work self. There's yourself. With that said, you have to put the appropriate guardrails in place so they understand what the standards are. It goes without saying, I guess. The third thing is we call it ROC, and I think a lot of people use that term, especially in entrepreneur conversations. But ROCs are the big things that really need to get done. But that is how you define your career. Like, what are the big things that you produced, or are you just talking about busy work and you're, consumed with that? And the last thing is growth. If you don't have a growth mentality and you believe yesterday is tomorrow, you will be way behind. So we, serve, pro, rock, grow are the four that we use to describe it. But the advice I give to people, I mean, it's actually pretty simple. If you're looking for a job, I would say the same thing to to my kids is, find something you care about and work with people you care about. And that's what we're trying to create as a culture. That's how we focus.
Perfect. No, I think it's very helpful. And so if you think about the journey you've taken, so you've been deliberate about the culture, over the course of time, company has grown significantly. You've also had an ownership change, which again, for those in the room who are building something or looking to build something, there's a pragmatic reality that no matter how passionate you and your team are about what you're doing, at some point in time, there's a liquidity sort of discussion. There may be someone outside the company who provided capital and now they want liquidity. And so that becomes a reality. And sometimes companies just need more capital and things change. And so how did that come about? So basically the sale process, how you chose who you want to sell to, and now kind of looking back that you've got 4 or 5 years under your belt and kind of a different ownership situation, what does that look like today? And how are you feeling like the company's changed versus still the same old kind of rocking, growing company?
Yeah, so when I first got there, like my attitude was, I'll assume I'm going to work here for the next 10 or 20 years. And that's advice I give to everybody in every job that they ever take, is assume you're doing this for long term and this is the only job you're ever going to have again, because that will guide your activity in how you treat people and how deep you go initially. So I had a really long-term view with Strata, but I didn't know anything about a private equity-backed company. I didn't know anything about venture capital. I didn't know anything about anything, So I don't know how this stuff goes. All I knew is that I didn't really care about when it got sold. That was the attitude that I was going to take.
Yeah.
That wasn't going to guide any of my decisions. So after a year and a half, we increased the visibility of the company significantly and got a pretty significant offer from a strategic to come after the company. Went down that road a little bit. Thank God it didn't work. But we had been prepped at that point, so we decided to open up the company through an investment banking process. Some of you guys may be familiar with how that works. We actually got 40 bids on the company.
Wow.
At a 4X on what the private equity firm had bought the company for just 2 years prior for a 16-year-old company with no additional investment, no additional acquisitions. So it's pretty stunning. We narrowed it down to 10. We chose a company called Roper Technologies for the reason I just described. Roper is a publicly traded holding company. It's actually one of the largest companies in the world. It's one of the 500 companies in the S&P 500 index. So the way I'd explain it is Berkshire Hathaway, Warren Buffett, that's a holding company. Roper's a little bit different. They own companies in their entirety. They've been around since the 1800s. All of the companies stay with Roper pretty much forever. And so this was an opportunity that I saw not to have an exit, but to have a starting point of really continuing to build a really special company focused on solving big problems here in Chicago, and that's why we chose Roper. One of the propositions with Roper is they believe in niches, so they don't believe in integration. You buy your company, you're on your own, right? And so that autonomy was incredibly attractive to me. And since the time that they invested in the company, we've grown it. It's only been 5 years. I'd say, I'm sure I get the math right. Let's just say it's worth 5 times as much as they had bought it for, at least. So it's worked out pretty well for them. But it's exactly what I had hoped it would be. We're an autonomous business, and we don't go to anybody else for decisions. We own it, in terms of what happens.
That's great.
Yeah.
Now,
which is, to your point, which is why I'm here 5 years later.
Yeah, no, absolutely. Yeah. I mean, it can, a sale of a business or a material change in a cap table can have such a significant change in the look and feel and trajectory of a company. So that's really great to hear. That kind of decision on the front end has so much impact, basically on the back end. If you think about one of the things we talk about internally in our organization is in healthcare, with the importance of what your organization is doing, what our organization is doing, and with the people that, frankly, whether you are working with every day, trust is so important. And and you and I have talked about it a little bit. You've written some articles over the course of the last few years. You spend a ton of your time, and your team spends their time in the C-suite with healthcare executives at major systems. These people could choose to spend their time kind of doing within reason whatever it is they want, and they are choosing to spend the time with you and trying to solve their problems with you. Let's talk a little bit about how do you build that trust, and how do you basically sort of teach a team and scale that value within an organization, and then basically do that externally to kind of help grow and also maintain your customer base.
Yeah, I mean, to some extent, it comes down to whether you're trying to sell a product or whether you're truly trying to build relationships and then through that help them solve problems. So I hate to be redundant, but that's what it comes down to. Once you decide that's what in fact you're doing, it drives different activity. So we've written books, we've created a series of best practices that we open source for free to all of our customers. We have a number of groups like the Advanced Planning Institute, the Total Performance Network, these groups and societies that we formed within our base that cost nothing for people to participate in. As you know, we publish a ton of things that are more about what do we see and what are people doing and how can they benefit from it. So we're a big believer in sharing what we learn at scale. But here's the reality. 8 years ago, this company was not even known by its customers. Like they wouldn't even know our name. So what we really had to do was transition from being a product to being a platform. And that was the biggest strategy, I think, that we nailed in order to be in the position that we're at. Because what Strata Jazz is our product, is a modular system. So there's 15 different modules that people can access. And then there's a broader set of data that we then pull from that called Stratosphere, which is now the largest database of cost information on the planet. And through that, we can do research and we can provide insights. And we do all that for free, just because we think that's the right thing to do. So I think the ethic of the business model really is what drives us towards, man, if people really know us and trust us, they'll do more with us. And so we have a obsession around being in front of customers, spending time with customers, listening to customers, caring about customers. And it's not a relationship, it's friendships, that we really focus on building. And when you have that with your customers, your job is so much more fun.
Yeah, sure.
Right? And you're able to deal with, when bad stuff happens, you're able to deal with it because you're like, hey, let's be open about this. This is a problem, we're gonna work through it together. So there's a lot of things that go into that word. But what I would say is this, for everybody in this group, which is a healthcare group, the single most important thing is trust, right? And you can see businesses that don't work because they aren't able to deliver that. So when I came to Strata, the one thing I didn't try to do was grow the company fast. There was a lot of problems in terms of the base business. Everything we did was customized. There was 5 instances of Strata to single customer. So we really had to kind of rebase the company, restructure everything that we did at that time in order to build any trust down the road. So when I first got there, quite frankly, I spent a year doing an apology tour. I went to all of our customers and I explained, okay, now that I've spent a lot of time looking at this, I can tell you exactly why this is a problem or why you're not getting good support or why these upgrades aren't working. I can tell you exactly why. And I'm gonna tell you what we're gonna do over time if you stay with us to make that transition. So we literally had to transition all of our customers into a completely new product, new structure, and we actually made them pay to make that transition. And we only lost a handful of customers in the process. So we did a complete reset of the company while still growing this business, not to get too specific, but just to give you a sense, this is a business that's hit every quarter for 8 consecutive years. We've grown 20 to 30% a year top line and bottom line. This is a real machine. All of our customers signed 5-year contracts, essentially close to 100% renewal rate. So going into any given year, we have 85% of our revenue or close to it under contract. So the reason why that's important to understand from a business model perspective, when you have that kind of structure, you can really think long term,
Sure.
right, about what you're doing. That's what creates maybe a buffer from doing things that are short term that would then violate trust, right? Because that's what a lot of companies fall into. They're just trying to close the quarter. They have a board meeting coming up. They want to get that deal over the fence, but you end up paying for that down the road in a big way. And it's hard to see that until you've made the mistakes, at least that I've made through the years. So that helped inform a lot of the things that we're now doing at Strata.
Great. No, it's really helpful. One of the things, just as I listen to your story and as I listen to these aspects of it, so much of this, frankly, feels like healthcare. At the end of the day, there's tons of change. There's a lack of clarity. You fail. You basically figure out why you failed. You try to fix it, and to your point on the Rubik's Cube, you fix that, and it causes some other issue. providing basically clarity amidst basically a lack of it and amidst change is really indicative of leadership. And I think a number of the things that you've been talking about here are very much indicative of leadership. You have a terminology used called jazz leadership that you feel basically has been really instrumental in sort of the growth story and the development of your team and your company. It'd be great to learn a little bit more about that.
Yeah, when I was in grad school, a woman named Roseanne D came and spoke, and she, at the time, if you can believe this is really bad, she was one of the highest ranked Fortune 500 women executives in the country, and she was a VP at Amoco, right? But she talked about this book called Leadership Jazz by a guy named Max Dupree. And so is anybody here a jazz fan? Anybody like jazz or seen jazz? All right. So I went to Indiana University, and they have a really good music school. One night I was walking by a door, and I saw them practicing for their orchestra, and it was the most intense, atmosphere I've ever seen. And it's like, here's the script, you got to do this, and they went over and over and over again with the same portion. And I guess they nailed the last one because he seemed happy, but it was pretty miserable and pretty tense the whole time. At the time I was at IU, also Dizzy Gillespie came through. Dizzy Gillespie, the guy with the big cheeks. And the crazy thing about that performance is he was like behind everybody most of the time, right? And so when I read this book and heard her talk about it, and then I read the book, boy, that just made sense to me. Like a orchestra is like you get up on a podium in front of everybody, on top of everybody. At the end, you get all the credit, right? If someone does something wrong, you call them out specifically. There is no improvisation. That is not how businesses run. Leadership, jazz, on the other hand, is, hey, we're making this up as we go. Like, we don't know that we're going to this address in Miami, and we're going to be there at that time. We may know that we're heading south. That's what strategy is, right? But we're going to learn things along the way. We may end up somewhere else, right? And for people who are creative or people who are passionate, they get really good at doing certain things. So I don't need to teach a person who can play the saxophone really well to play the drums, which is how a lot of people manage.
Right, sure.
Right? I need to help them be the best saxophone player they can be, and I'm not going to be ever as good as them. So my job is to really coach and support them. That's really what leadership jazz is. Our product happens to be called Strata Jazz, so it's a pretty convenient analog to bring together. But it really does inform kind of how I do things, and sometimes it doesn't work. Like I really do give people a lot of room and do celebrate, when things don't go well, because I think that is part of the process of learning and growing.
Perfect. No, I think it's great, and we're gonna a little jump around here. I think folks are starting to submit some questions, and I think there's some really good ones here that I think would be great to cover. So one of them, honestly, I think it's at the heart of everything that happens in healthcare. No matter what you're selling, consulting products, software, doesn't matter. Patient care is basically the ultimate outcome of effectively everything that everyone does in healthcare, which is very different than other industries. And so how do you think about that in the context basically of what Strata does basically for your clients? How are you thinking about basically the impact on patient care, basically from the work that you do?
Yeah, it's massive. Here's the problem. The problem is that there's so much waste happening in healthcare. Obviously, people have heard the numbers, but estimated over $1 trillion. So that is not providing any benefit to anybody, right? So if we don't identify that we can invest in the things that you need to. And obviously, I think people know that it's shifting from just being a patient-centric mindset to a consumer-centric mindset. And that is going to require significant investments. So if you're looking at trying to, get people more engaged on social determinants of health, right, and things that need to happen in the community, those dollars don't exist, right, unless we free them up somewhere else. And so when you look at once again, the kind of the margin profile of hospitals and health systems, they're operating at like 2% margins. What kind of business, who would go into a business or pitch a business that has 2% margins? I don't know. Anybody in this room? Is that like the business plan for any business that's going through Matter? Right? So this is a really challenging, set of financials. And so if we can do a much better job at doing the things that actually matter, to use the word, in healthcare, then we can invest, in the things on top of that really give, kind of that next level of care that now needs to be provided. I mean, the things that are coming online with healthcare, with whether it's genomics or whether it's the data side, which is to me like the biggest opportunity, and it's very similar in many ways. is going to require a whole new set of skills and a whole new way of thinking, right? So, I say to people like who are in healthcare, like this is without a doubt the most exciting time ever to be in healthcare. A lot of people can't see the forest through the trees because all they do is see the problems. For good reason. Unless those problems get addressed, you're not going to make a change. And unless you have data, you're not going to be able to address those problems. So that's really, at the end of the day, what we're trying to do is make that data liquid so that it gets in front of the right people so that they can make the right decisions. Think of sports, right? Like we had Paul DePodesta, who, if you guys saw Moneyball, the character that Jonah Hill played, that was really the hero of the story. That's Paul DePodesta. And we had him come speak, and I interviewed him, and I asked him, if you were to come into healthcare, what would you do? Because he's now trying to bring the concepts of Moneyball to football actually as well. And he said, I'd ask 2 questions. Okay, so what would you do? I'd ask 2 questions. Okay, what are the 2 questions? Well, the first is I'd ask people, what information do they need that they don't have? Okay, and what's the second thing you would do? The second thing I would do is ask people what they know for sure. I'm like, all right, so unpack that a little bit. He goes, well, these are highly trained physicians who have wonderful education and great experience, and they're trying to, in the moment, make the best decision they can for the patient. I think we all believe that. 85, 90% of the time, they're probably right. So I'll validate that for you with data, and then let's go look for that last 10%. So I was doing grand rounds at Loyola a couple weeks ago. For those of you who don't know, it's when you get to speak to a whole bunch of physicians about a topic. It was the first time I think they had brought in a non-clinical speaker. Mm-hmm. I had 150 physicians in the room. I said, answer that first question. Okay, answer that first question. How many of you get the data that you need to be able to do your job? Not a single hand went up, right? Then I asked them, how many of you, because we were talking about the cost of care, would like to get the information on what things cost and would use that information to help inform decision making? Every hand went up. And there was administrators for Loyola in the room, and it's sort of like, okay, I think they're trying to say something here. So that's kind of how we look at it.
So let's unpack that a little bit. So because it's a really tangible example. So I think for people to try to cross this chasm of, I get what clinical care is, I get this costs a lot of money, nobody ever kind of fills the gap. So where are they starting? Where did the physicians basically say that they wanted to start to try to get a better idea about cost and start to make a difference?
Yeah, I'll go back to the Yale example.
Yeah.
It's just understanding. Once again, I wanted to emphasize this. Looking at cost in a silo by itself is useless.
Right.
Being able to incorporate and bring that information together, that's where the story is told. So I think just taking that first step, when you do all the research, it doesn't matter whether you provide that information prospectively, retrospectively, or in real time, because we could actually embed cost within order sets within Epic.
Yep.
It really doesn't make a difference in all scenarios. That actually is effective in helping to bend the cost curve. So once again, $2.5 trillion are flowing through hospitals and health systems. So if we choose to provide no information, what do you think the outcome of that's going to be?
Right.
Probably not so good. And on the patient or consumer side, we all know that the pricing problem in healthcare just kind of baffles the mind, and it's not a defensible position for hospitals long term, right? They just can't explain why something should cost A here, and D over there, and understanding that is just beyond people, right? They just can't get into that detail. So the need for simplicity is stunning, around the whole consumer process. And that's going to be a big area of investment for a lot of hospitals and health systems. But once again, you can't do that or compete if you don't know or understand the cost. One example I'll give on this is Walmart.
Yep.
So I was at a meeting with the head of healthcare for Walmart a couple weeks ago, and he basically said there's a huge myth and misunderstanding of health systems and how they work. I'm like, okay, I work with them all the time. Why don't you explain that to me?
Sure.
And he said, well, they say their biggest value in what they do best is relationships and trust. It's like, okay, so we studied that. And he goes, well, here's what we found. We asked people, do you have a primary care physician? 50% of the people said no.
Right.
So there goes half the market. Oh, well. The other half, okay, can you name your physician? And have you seen him or her in the last 2 years, which would define a relationship? 2/3 said no. So Walmart's like, well, okay, so for that 16%, you got them. We'll take the other 84%.
Right.
And there's 150 million Americans going through Walmart every day. They're really good at understanding transaction cost. They're really good at lowering cost. So they are now opening eye, vision, health centers combination with a new front door at Walmart, in Georgia and other states, because they see this $4 trillion opportunity not being served, in the right way.
Yeah, I mean, it's an area, frankly, we're tackling head on. I know you and I talked about this the other day. We're in partnership with Walgreens. We basically put some primary care clinics into Walgreens locations, and you're seeing it resonate with people because the idea is you don't have to go to a really uncomfortable beige building with no parking, basically, to go get your medical care. So it's completely fair. Let's pull the thread a little bit more. You've been touching on this concept of pricing transparency and patients as consumers, which is something 10, 15 years ago nobody really wanted to talk about. How are hospital systems today looking to combat exactly what Walmart's talking about, which is they have a problem. They basically have this opaque issue, and they historically have not been able to tell their patients, this is how much it should cost, and this is why, and here's how we can finance it, et cetera. How are you seeing them start to go about this in a way that's more consistent with other industries?
I think they're in the first inning at best.
Yeah.
I mean, there's just such a long way to go. So I'd say they're incredibly vulnerable. With this huge data set we have, we can do some interesting research, and part of what we did is many people politically know the term Medicare for All. But the question that hospitals and health systems need to wrestle with is, okay, what if all we got was Medicare rates? So we took a look at that, and there's three scenarios we looked at. What if we went to Medicare for All? What if we went to Medicare for All who are over the age of 50? And what if we went for all who opted in, using some type of projection on that? What we found is in all three scenarios, hospitals will continue to make money on a per procedure basis, as long as all you do is look at variable cost. The moment you look at fixed cost, they lose money on every one. So think about what you just said. If you're sitting outside of a hospital or health system and you look at what I just described, you would say, I don't have fixed costs. Maybe I can carve those things out and make money on the variable cost side and just have a low, and that's what's going to happen. And unfortunately, from a community service and then also a regulatory perspective, hospitals are 24/7 operations. They have to provide a whole set of services. They have to make big investments in capital. So we really do need to protect them in the way that in terms of understanding what they're up against and how they need to be that support structure within the community. I mean, hospitals are the largest employer in almost every community that they're in. So I think there's bigger questions that are part of this. It often gets politicized, but if you just take the politics out of it and just say, what is the new business model for healthcare, that's where it becomes interesting. But there is going to be a lot of innovation on the edge, and it's going to be hard for hospitals to be nimble enough to go after that.
Yeah, no, it's clearly challenging. I would agree. I think the industry broadly is in the first inning on this at this point, and hospitals are kind of in that same situation. We have about 5 minutes left. You and I both basically signed away everything we have to commit that we would be done exactly at 7 p.m. So,
I didn't sign anything.
They didn't make you sign that. Interesting.
After Steven threw me under the bus, I was pretty much done with him.
So, one of the things I think in our conversation from the last couple of days here that I think we'd be remiss not to cover. You've done a lot professionally. I think we've covered quite a bit of that over the last 50, 55 minutes. You've done a lot personally as well, and I think it's perpetually a challenge now in a very complex industry. Where basically folks like yourself are heavily committed to their companies and their teams, and their shareholders. These can be things you do 24 hours a day. And the reality is, I think that many of the people in this room have chosen healthcare because they want to do something besides just the job. Mm-hmm. And so you've clearly found ways along the way to make an impact outside, effectively, the office. And so I think it'd be great to kind of just talk a little bit about what you've done with some of the not-for-profits that you've been involved with and causes you've chosen and how you figured out how to balance effectively work and life to make that work.
Yeah, well, I think, listen, I mean, like I said before, I don't think you need to have a work self and a home self. You need to be yourself. So I've always really emphasized just being myself, and I'm, a quirky guy in many ways. but I'm super passionate about making a difference and finding ways to do that in a tangible way versus just, hey, we're doing this and everybody let's join in, can be challenging, because there's inertia that kicks in where, folks do things because they're supposed to versus because they truly care about it. So one thing we did, which is pretty interesting, is we do have a relationship with the Greater Chicago Food Depository. We have done an annual hackathon with them where we try to bring technology companies from across Chicago together. As many people know, hunger is a health problem, and we feel like using data and thinking through applications that can help solve problems is a good way to use and spend our time, and we've had a really good response on that. At the same time, not everybody in our company is going to feel the same way about that particular issue, even though 1 out of every 6 kids in Chicago don't know where their next meal will come from. Guilt trip. That may not be your issue. So in terms of trying to find people and meet them where they are, one of the things that we did last year was have a company-wide hackathon where anybody in the company can get up and pitch a cause that was important to them. It could be personal, affecting them, their family, their friends, whatever it is. We had 17 people get up and take a 2-minute pitch on what they were passionate and cared about. We funded all of them we gave money to.
Wow.
Now with that, we said, okay, now we're going to break up into these 17, and everyone in the company can go spend a couple hours hacking that problem on those 17. We then had all 17 come back and present in 5 minutes on how we could better make an impact in that area. And then we used Slack to vote on the 5 what we called impact initiatives that we all funded with a couple $1,000s as a Kickstarter or seed money type of campaign. So literally everyone in the company was involved in nurturing the selection of this. Those are the kind of things I think that bring a level of authenticity to wanting to really make an impact versus just say you're doing something. So that would be one example. In terms of how I balance it out, I actually think everyone says it, so I have a hard time getting comfortable with repeating it, but if you're passionate and you're into something and you're excited about it, it doesn't feel like work, right? So I think, I run marathons, I do a lot of nonprofit work, and I love my job, and I don't feel like I sacrifice anything at all relative to my family whatsoever. I don't do calls or meetings on the weekends at all. Our team is pretty disciplined that, you won't see messages or meetings set up after 6 o'clock. I'm very conscious about when I send emails because I know the trickle effect that it has. So I think a lot of people are victims or have a victim mentality when it comes to work. I don't particularly get it. I think you have a lot more control than you think you have. How much you care, how hard you work are completely within your control. And those are probably the 2 most important things.
Yeah, no, look, I think it's a great perspective. It's absolutely great perspective, especially as people kind of progress through their career and see their own life changes to try to figure out that balance. We are right on 7 o'clock.
All right.
So thank you, Dan. I appreciate you taking the time.
Appreciate it. Thanks, everyone.